Hey darlings, welcome back to my channel and welcome back to another video, guys. Today's video is about infertility, and we are privileged to have a fertility specialist on this channel today, and he is in the person of Dr. Attoh. Guys, this doctor was part of the doctors that helped our own Anama McBrown to have her child, and he's also a fertility specialist at Chosen Hopeful and Fertility Center, and he's also a member of Fertility Society of Ghana and a member of Fertility Society of India, and also he is a member of European Society of Reproduction and Embryology. Okay, and he's also a former medical administrator for Pentecost Hospital, Medina Estates, guys. So you can imagine the tips and everything that he's coming to give us free of charge. So kindly like this video, share, comment down below at the comment section. So without wasting much time, let's go straight into today's video. So Dr. Attoh, you are welcome.
Thank you.
To this channel. So you are going to take us through, when we talk about infertility, everything that we are to know about it, what brings about it, how it is managed, and everything that we need to know about it. First of all, how big is the issue of infertility in our sub-region here, or even the nation as a whole, when you talk about infertility?
Thank you very much. When we say infertility, we mean the inability of a couple, a man and woman. I don't mean woman and woman or man and man. Inability of a man and woman to achieve pregnancy after they've had adequate, unprotected sexual intercourse. Now, let me explain, because these words are technical. When we say adequate, what we mean is that you should have a minimum of at least 3 sexual encounters. 3 sexual encounters within a week.
Okay.
I don't mean you have all 3 sessions in one day, but 3 different days of the week minimum you should meet. If you do that for a whole year without any family planning method, whether artificial or natural, and you don't achieve pregnancy, then we say the couple is infertile. Now, infertility is a big issue worldwide. It is estimated that about 15% of the couple in the reproductive age group will have infertility. So if you can imagine, if we are about 39 million in Ghana, you look at 15% of 39 million, I mean, let's use that arbitrarily. That should be the problem, the magnitude of the problem. It is a problem if it even affects only one person because of the ramifications of what happens. It's a problem because in the society in which we adore children. Every couple is expected to have children, but not every couple can make babies. Even in the Bible, it is there. And you know, people's wombs were shut by God. Some had God's intervention. So infertility has been a problem from since, and it remains a problem. So it is this big, and it is a problem, especially in our part of the world.
Okay. Thanks so much, Doc. So the next question that we'd like to know is it applicable to all age groups, or we have a specified age group that we say at this age, if you've not given birth, then you are infertile?
Well, we are talking about people within the reproductive age group. So we are talking from about 15 years up to like 48, 49, or let's even extend it to 50 years. So men and women within that age group is applicable to them. Before puberty, you cannot conceive, you cannot make anybody pregnant. So it doesn't apply. After menopause, especially for women, that also becomes a problem for you to naturally get pregnant. But you can still get pregnant after menopause through artificial or assisted reproductive technology. Okay.
So please, you'd like to also know the causes of this infertility issue. Is there any cause, or is there any effect? Like, we want to know what actually brings about this infertility.
Well, the infertility causes, when we want to talk about them, we would have to talk about broad things: female factors, male factors, and then sometimes not only that, but a combination of other anatomical issues. Now, for you to be able to conceive, your anatomy must be ready. For example, as a woman, you must have a uterus, you must have a tube that is open, you must be ovulating, and then you must have a vagina through which, I mean, the
passage of delivery.
Yes, not only delivery, but that is where you will get the semen introduced. Yeah. Okay, there are some people who are born without an open vagina. Yeah. Their hymen may be so thick and covering they cannot have sexual intercourse. Some people are born without a womb. Some people are born
naturally.
Yes, there are some syndromes.
Oh, okay.
That you have a woman without a womb. Yes, and then sometimes too, their female reproductive organs do not develop at all. So in such a case, that person cannot get pregnant. When you talk about the men, there are other conditions. It could be genetic, which makes the man more of a feminine type. He doesn't have a very well developed male organ. Sometimes, he doesn't produce semen at all. Sometimes this may be acquired or may have occurred genetically or through the birth process. All these things can affect. And then the manhood. You have a situation where sometimes the opening of the urethra, that is the tip of the penis, doesn't open at the tip to introduce. You find a hole down the hypospadias or epispadias. All these genetic issues can affect the man being able to impregnate a woman because of how the semen is released. Now, we can also broadly look at it in this way. If you look at what happens, we can look at what we call tubal factors, which is predominant in our part of the world. You can look at the uterine factors. You can look at the release of the egg situation, that is ovulation factors. And then you can look at the men. The men is only semen. So in the woman, a woman must have a good uterus. That is the incubator, which will incubate the baby as it develops. Sometimes they get pregnant, but the pregnancy does not stay. It is miscarried, and it can be recurrent because of uterine problems, which may include fibroid, polyps, and so on and so forth. Majority of the cases in our part of the world is due to tubal problems. And when we say tubal problems, there's a tube on each side of the uterus. These tubes can be blocked, and mainly through infections. So women get vaginal discharges, they just take them as it is just white, a normal thing. They don't seek treatment, and it goes on to affect the tubes and therefore block them. Some due to recurrent, infections from chronic pelvic inflammatory diseases. Some maybe have some instrumentation into the uterus or an abortion done, and they are not done properly, and subsequent infections, they go to block the tubes. So in this part of the world, about 40% of all the female problems are due to tubal problems, because one, they don't usually take care of themselves, post-abortion complications. Two, infections from STIs, because we don't often use protection during sexual intercourse. And chlamydia and gonorrhea are two big germs that give such problems. People also have all sorts of instrumentation, and they are not done well. Even in this part of the world, people introduce a lot of things into their vagina, all in an attempt to make them look tight. And that in itself may not be sterile, and they cause all sorts of problems to block the tubes. In a few of women too, they may have hormonal problems, which will not make them to ovulate, one of which could be polycystic ovarian syndrome, and then some other hormonal problems. Some of them may be due to some other diseases. They use some chemicals and things or drugs that also go to affect the ovaries and the ovaries do not release eggs during ovulation. So all these things are part of the problem. But generally, what we say is that 30% of the problem comes from the woman alone.
Oh, okay.
And then another 30% comes from the man alone. This is what most people don't know. They think that as long as they can have sexual intercourse, especially the men, as long as they can have sexual intercourse with a woman, then they are okay. But it goes beyond sexual intercourse. We are not talking about erectile dysfunction. That is different from infertility. So about 30% of the problems of infertility comes from the men. And oftentimes the men do not want to admit. They say, oh, I can have sex with you, so I'm okay. Or a lady has been pregnant for me, so I'm okay. And these are the regular excuses. Meanwhile, most of the pregnancies that they think were theirs, it's actually never theirs. Because they want children, they bring it to them. I've seen one. One of my clients had 7 children. None of the children actually was his. Yes, from 3 different women. So you can see, we behave, the men especially, we behave like ostriches. We hide our heads in the sand with our tails hanging out. We think we've hidden. These are problems. And then we say that a 30% could be a combination of both male and female factors. All these make up to 90. And then 10% of the times we don't know what caused it.
Oh, okay.
So we call it unexplained infertility.
Okay.
Or infertility of unknown origin. Maybe with time, more advances in medicine will come, and we shall understand some of these things. But for now, we categorize them as such. Okay. So in short, these are the problems and the causes.
Okay. All right. So guys, I hope you have really enjoyed today's video. We don't want this video to be lengthy, so we'll end here for today's video. In the next video, we will continue with Dr. how we can manage this infertility. So kindly like this video, share, comment down below at the comment section, and we'll be leaving doctor's contact down below at the description box. Go and check doctors out for all your infertility problems, and he's gonna solve them for you. Thanks for watching, and see you again in my next video. Bye.